Hello, and welcome to this demonstration of the Pregnancy and Health Profile, a screening and risk assessment tool. My name is Emily Edelman, and I am a project director at the National Coalition for Health Professional Education in Genetics, or NCHPEG, one of the partners of this tool and this project. The Pregnancy and Health Profile was developed by a partnership of organizations including NCHPEG, the Genetic Alliance, Harvard Partners and Massachusetts General Hospital, the March of Dimes, and the Health Resources and Services Administration, who is also the funder of this project. The goal of this tool is to improve identification of women and babies at risk of genetic disease. Our approach is to use the first prenatal visit as the opportunity for intervention for the patient and the provider. The tool collects patient personal and family health information, as you'll see in a few minutes, performs risk assessment using clinical decision support algorithms that we developed based on professional guidelines, and presents the clinician with a report pre-populated with patient-entered data and also containing the clinical decision support messages that are presented in the form of considerations that can be used in patient management, patient risk assessment and management. To download the tool, go to hughesriskapps.net. Please contact us with any questions about the tool, including accessing the tool, how to use it, more information about the tool, opportunities for partnership in the future. You can contact me, Emily Edelman, my address is here, or Bruce Lynn at the March of Dimes. Okay, so let's get started on our demonstration. Imagine that we are in a doctor's office. The tool has been installed in this clinic for use in prenatal risk assessment at the first visit. When the patient signs in for her appointment at the registration desk, the staff at the front desk would click on this icon, which has been installed on a tablet computer available specifically for the purpose of using this questionnaire. The staff would log in to this questionnaire using the username and password that were set up for him or her during installation, and would select the information for the patient standing in front of them. The patient is then handed the tablet computer and asked to confirm her information. The questionnaire begins with some basic instructions for the patient, explaining why this information is important, why she's being asked to provide family and medical history information. We have two videos in this tool. The intention of the videos are to make the patient feel comfortable and orient her towards how to use the tool. They have audio as well as the script running on the bottom and subtitles. You all are not going to be able to hear the video the way that I am recording it, but you can see the text here, and I will go ahead and read through the script as well. This information stays between you and the provider. It will not be shared with anyone else. My name is Christine, and this is my daughter Nico. I was sitting in your place not too long ago, and I'm here to help you use this tool. It's simple and includes instructions to help you along the way. Fill out what you know and skip the questions if you're unsure of the answer. If you need more information on a topic or don't understand something, click the information button. Remember, the tool is not meant to replace your visit in any way, and you can still ask your provider questions. This appointment is about you and the health of your baby, so let's get started. The questionnaire begins collecting some basic demographic and patient characteristic information. The patient's not required, by the way, to select any of these screens. You can skip them all. We ask about special education classes and any learning problems. We ask about adoption status. We ask some very detailed questions about race, ancestry, and ethnicity on the next few screens because the patient's racial and ethnic background is important to tie into our clinical decision support algorithms. We provide recommendations for carrier screening based on patient ethnicity. So here we're collecting information about patient race. Here we collect information about country of origin. She can select as many of these answers as she wants. She doesn't have to select any. Hispanic status, and Jewish status. So the tool also collects information about patient lifestyle, safety, and general other risk factors. The reason for this is to help streamline intake at the first prenatal visit. So we want to collect all the information that the patient would be asked to provide through a form or perhaps through an intake and present this all to the provider at the same time. We ask about some risks like domestic violence risk. This is standard part of intake these days for all women, all healthcare providers. And now we're getting into medical history. So you can see here for some of our questions, if you click that you have epilepsy, if a patient clicks that she has epilepsy, we then ask about medications. And you can see that some of these medications may be associated with a teratogenic effect on the pregnancy. And we also have info buttons here that provide additional information about the condition, about the medical term. Additional health conditions are listed on subsequent screens. Some genetic conditions that are included in the decision support. And now we're getting into some general obstetric risks. These are not necessarily genetic risks. It's about vaccinations and the age of vaccination, history of infertility, smoking. I'm going to say no, I've never smoked. No, actually, I'll show you all. So we'll say I quit smoking 2 years ago. I smoked half a pack a day. No, I did not quit because I was pregnant. And yes, I'm living with someone who smokes. I haven't had no CT scans or x-rays, been exposed to other chemicals. I do work with children in my job. No low-calorie diet or eating raw meats or fish. We asked similar questions about alcohol use. I stopped drinking recently. I was drinking more than 19 drinks a week, and I stopped because I found that I was pregnant. We ask about medication use, including prenatal vitamins, recreational street drugs, and again, you can see we include messages here for the patient for some of these sensitive questions to try to explain why we're asking this information, so to improve their comfort level in providing the information. Any allergies? We collect information about LLP. And also collect information about due date. And we also ask a number of questions about each pregnancy that the patient has had in the past. The complications and or conditions that a baby might have through past pregnancies can certainly be associated with an increased risk for the current pregnancy. So I've been pregnant 2 times before. My first pregnancy I was 20, and this was a live baby. How old was I when I delivered this baby, or what was my gestational age? 36 weeks. And I'm going to say it's a normal vaginal delivery, but also that it was preterm. This was a little boy. Yes. He didn't have any of these conditions, but he did have some health problems. So he was diagnosed with autism, and he also had an abnormal newborn screening result. And I can learn about what this is. Excuse me, wrong button. I can learn about what this is through clicking on the info button. And this baby is still living. I was 22 during my second pregnancy, and this was a miscarriage. Did not have any of these health problems during the pregnancy. I don't know the cause. And then we're done with the pregnancy loops, and we're asking about anybody else in the family who had abnormal or positive newborn screening. So now we're transitioning into family history questions. So we have another video, and this is intended to, again, remind the patient why this information is important and remind the patient of who counts as a blood relative. We're going to ask you about your family health history and the family history of the father of the baby. This will help us figure out your risk and the baby's risk for certain conditions. Knowing your family health history is the first step on the road to better health. Fill in what you know, but it's okay if you don't know everything. The doctor will give you more information so you can talk to your family when you get home and bring that information back to your healthcare provider at your next visit. First, we will ask which conditions run in the family. Then we'll ask who in the family had each condition. Take your time. And remember that we only need to know about your family related to you by blood. You do not need to enter information about relatives who joined your family by marriage. That means your sister, not your sister's husband. Your doctor will go over your answers with you during your visit. So we have some very similar messaging in text format as well. So you can see that we have similar questions here asking about conditions in the family. So let's say somebody in my family has blood clots, somebody has depression, somebody has developmental delay, none of these conditions. So now I'm being asked to say who in the family had these conditions. So I'm going to say that my father had blood clots, my mother had depression, and it was actually my uncle had developmental delay, so I'm going to wait on that. My father had the blood clots, my mother had depression, and here's where I can fill in about other people in the family. So my uncle on my mom's side had developmental delay or intellectual disability. And then also on my dad's side, my aunt had blood clots and depression. This is a question we ask to tie into our Fragile X syndrome screening. We ask about any older male relatives with tremors, shaking, or balance problems. So that's it about the health conditions in the patient's family, and now we're going to ask about family structure. I have one sister, one brother. My mom has two sisters and one brother. My dad has one sister and two brothers. And now we're going into the father of the baby, his history. My husband is the father of the baby. He's currently 29, and he is a business person. He's not been exposed to any chemicals. We ask about whether or not there were any children that the father of the baby had with another woman, particularly screening for multiple pregnancy losses. So he's had 2 children with another woman, and there were no miscarriages or stillbirths. So we ask similar questions about race, ancestry, ethnicity for this individual. His country of origin, he is not Latino, and we will say that he has some Jewish ancestry, Ashkenazi Jewish ancestry. And his family history is negative for all of these conditions. There are very few opportunities for free text in the tool. This is one of them. So is there any other inherited condition or disease that runs in your family? And I can type it here. Takes a while. Alpha 1 anti-trypsin. Has anybody in the family had genetic testing? I'll say yes. I've had genetic testing, and it was for cystic fibrosis carrier screening. We ask about consanguinity. We can collect email addresses, but we don't do anything with this information. And then we're just about done the survey. We have a thank you message here, and we also have some information, some education for the patient about newborn screening. This is the first prenatal visit, and we can get the conversation started with the patient about educating her, alerting her about newborn screening. And you can see here some basic messages, and it ends with your medical team will tell you more about the different kinds of tests you and your baby will get. So it starts the conversation and sets the expectation that the OB will be or the prenatal provider will be talking with the patient more about newborn screening later on in the pregnancy. Is there anything else that you'd like to talk about? No. That would also be a free text. And we're done. So we can quit this. And now let's take a quick look at what this report looks like. So here is the patient who just completed this, Crystal. So I can pull up her document, her pregnancy and health profile report, and open it. We typically set up users so that they are these reports are automatically being generated and automatically printed, sent to print at a printer in the office. So the provider can grab the report, review it quickly, and then use that information to talk with the patient about her risks and management during the visit. And this report's getting pre-populated here. Okay. So this report may look familiar to some people. This is an adaptation of the ACOG antepartum record. This is a report that's familiar to many prenatal providers, and you can see that patient data is pre-populated into this report. Her basic demographic information, also father of the baby demographic information, her pregnancy history, the patient's medical history, some of her exposures and psychosocial and risk factors. And now we're getting into the genetic information, the family history information. So here's our table that shows whether or not the patient's had genetic testing in the past. Here we display family history information in two ways, both in a tabular format here in this chart and also in a pedigree that you'll see in a moment. The father of the baby's history is negative, but this is where his history would show up if there were any conditions in the family. And here's our pedigree. So you can see here's our patient with a personal history of epilepsy, a son with autism, and a previous miscarriage. Her family history is significant for relatives on her dad's side with blood clots, DVTs, a few relatives with depression, including her mother, and then a maternal uncle with intellectual disability. So let's take a look at the clinical decision support, and I'll blow this up. So the messages here vary in their origin. Some messages are universal, such as aneuploidy screening, because of the ACOG guidelines about suggesting offering aneuploidy screening to every woman. Some cystic fibrosis is another example. This message is customized based on the fact the patient had genetic testing results, but cystic fibrosis screening is an option for all patients based in these considerations. And then other red flags and risk factors here are listed based on the family history. So this patient has increased risk of having a child with autism and/or Fragile X syndrome based on the family history, and there are messages here about potential actions to take next based on the father of the baby's Eastern European, Jewish ancestry. We talk about the tool generates a consideration about potentially screening the father of the pregnancy for these Ashkenazi Jewish disorders. Similarly, our patient is of African American ancestry, so we screen for we recommend screening for hemoglobinopathies as well. And you can see that none of those conditions are triaged as higher or lower risk. At this point, it's up to the clinician to use his or her clinical judgment and determine which conditions and which risks and tests are appropriate to discuss at this visit, which are things that perhaps could be discussed at later visits. The clinician also has the ability to update the patient data. If through interviewing the patient, he or she finds out that the patient misunderstood something, you can go in and update that. So I'll show that to you very quickly. Here I've highlighted our patient, Crystal. I click on this button, OBGYN Clinic. This is the clinician management part of the software that the provider would have in the office. And I can click on Review Patient Survey and very quickly scroll to the section of the report that I'd want to change. So let's say the patient said, oh no, I didn't actually have cystic fibrosis testing. So I can erase this, change this to no, and then our clinical decision support will be updated. We can also look at the patient's pedigree here, and we can modify the pedigree, and we can generate documents here. So we can generate our report. The tool also can generate patient education fact sheets and provider education for additional information. So let's take a look at what these look like very quickly. Oh. Well, I don't want to print them, so let me try that again, because I just tried to print them. Here we go. Open for editing or for viewing. So while these are generating, you can see that this is a interactive way for the provider to view, update patient data over time. Okay. All right, here is an example of a patient fact sheet for cystic fibrosis. This is a patient who has a where cystic fibrosis showed up as a consideration, so we provide information about CF and CF carrier testing. And then here is an example of a Fragile X fact sheet for the patient. Again, similar information, and these would only be an option to generate based on the patient's risk. There are also information sheets that are geared towards the provider for additional information about the patient's risk factors if the provider wants to dig a little deeper. Okay. So that concludes the demonstration. If you'd like to download the tool, please go to hughesriskapps.net. And again, please feel free to contact me or Bruce Lynn with any questions or to learn more about the tool. Thank you very, very much.